I was invited, and at first, thank you for the invitation. I should tell you a little bit about my experiences with the new rechargeable Alpha Prime, and it's a pleasure to be here. The first question we have to tell us why to choose a rechargeable device. At first, I want to tell you it's to use cutting edge technology. But what's the advantage of a non-rechargeable device above the rechargeable devices? You can say they can be recharged, they have a longer lifespan. So why use a non-rechargeable device? There are some questions we have to tell ourselves. At first, it's the patient capable of using it. Have he the necessary technical skills to use the device? Sometimes when he can't use his mobile phone, or he is too old to have the experience with it, you are not advised to use a rechargeable device, a non-rechargeable device with this patient, because he is not capable of using it. The other thing is has he the cognitive ability to understand what he have to do? When he forgets to load his device, he doesn't recognize, okay, my pain is coming back. But the problem is when he's not recharging it for a longer time, then you can broke your whole device. It can be a deep it can have a deep energy loss, and you have to replace it. You have to do operation that's not necessary. So it's better sometimes when the patient is not suited for this kind of therapy, just stick with a non-rechargeable device and keep him and yourself a more easy therapy. The next part is sometimes patients are just lazy. They don't want to use a rechargeable device. They don't want to get there every week, put in the loading panel and do it week after week. Sometimes they say they just want to forget the pain. When you have a paresthesia-free therapy and the patient is not thinking about his pain, I think it's one of the best advantages about from this therapy, that he can maybe forget all about his pain. And I think this is our main target, that we get the patients pain relief, pain-free maybe, and they forget about their primary disease, the pain itself that we are treating. It's not even laziness, I think it's kind of an advantage of this therapy. And in the end, maybe the clinical parameters are suited for a non-rechargeable device. When the patient is, for example, we are using it for cervical stimulation, sometimes they need very low energy, or you have a patient who is running on 0.2, 0.3 milliamps. So why use a rechargeable device when a non-rechargeable is keeping the nearly same lifespan? Or when you are not sure if the therapy is working with the patient, then you have some kind of prolonged trial therapy. When the table trial and the trial phase was good, but you don't think he will become good on the long run, just use a non-rechargeable device so the patient can just keep it up for 2 or 3 years maybe. And when you say, okay, I feel fine, I feel comfortable, it's a good therapy, then you can do an implantation of a rechargeable device in the end. And of the Alpha Prime itself, there are some advantages he has over the other rechargeable products. As all you can say, you have a full body MRI suited therapy. You have no, you don't need to decide if you want to have an MRI compatible device, or you need to decide if I only want to have all waveforms. Here you have both in one IPG. Otherwise, you have a Bluetooth enabled platform, so you can keep your distance. For programming, for all the keep up stuff, you can keep your distance from the patient even in Corona times. It's quite one advantage you have to keep in mind. And you have up to 32 contacts. You can use 2 Infineons. You can combine it with PNS. You can do hybrid stimulation. You can do everything that you have in one device, and you don't need to decide what you have to do. Just implant this one and you have everything available. As we have seen before, you have available all the suited therapies from Illumina 3D to a combination therapy, burst, microburst, everything that you want to have is available in this device. But what from my point of view, I don't want to do here a commercial. For me, it's better to tell you the clinical parameters when I have used it in my therapy in our clinic. And I wanted to share an example of one patient of us who is very satisfied with the therapy. To do a little spoiler beforehand, but I want to tell you why we have the decision in this patient, in this special case, for a non-rechargeable device. At first, it's a 33-year-old male. He is suffering from years after years of lower back operations and chronic severe pain. He was implanted after lumbar fusion with an intrathecal pump. He has he got an add-on with a high frequency SCS stimulation because he suffered still pain under various changes from the intrathecal therapy. In the end, he suffered from an infection and the pump was explanted in 2019. Afterwards, he was still running with the SCS, but it kind of reduced in therapy effectivity on and on. He was losing his pain relief, and in the end, he is now with over 300 micrograms of transdermal fentanyl. He's still suffering severe pain, and the implanted SCS system, we tried to reprogram it. He was implanted in an external clinic. We didn't get some kind of pain relief. So we have the decision, we wanted to implant a new morphine pump because he was suffering of this pain. He was quite satisfied with this therapy, but beforehand we had no place to place this pump. He got still the old infected wound. It wasn't healing properly. On the other hand, on the abdomen, there was this old SCS device. So at first there was the decision to get a new, better functioning device with all waveforms available, so we could try to help this patient. We implanted 2 leads and an alpha prime. Here is the before and afterwards picture. I'm very sorry, because of a cyber attack, we have no actual preoperative pictures on the left side from this patient. So this is an older picture with still the pump implanted, and we implanted 2 8-polar leads and the alpha prime. And on the outcome, what I want to tell you, he got a very positively affected sleep. He has longer walking distance. All the quality of life was getting better. And what's the most benefit of is we can reduce the transdermal fentanyl is now reduced above 100 micrograms. This is an old dose. Now he is on 150 in the moment. He has still over 60% pain relief in total, and he is very satisfied with the device. We did some programming. He's still in kind of the prolonged trial phase, and we tried to see what's the best therapy suited for this patient. But in the end, I don't think we have to implant a new pump. He is very satisfied with the alpha prime. He's one of the first patients worldwide who have been implanted with this device, and I think we did a better therapy with lower effort and get a better result than we ever expected. So as I can tell you, just use this kind of therapy. We are very satisfied, and I think the patient will be on the long run also. So thank you for your attention, and keep on and keep calm and use neuromodulation. Thank you very much.